Hi, everyone. Good afternoon. My name is Flavia Giso, and I'm the Co-President and Chief Development Officer at the Jackson Health Foundation. Thank you so much for joining us for our series in Conversations in Care. And I'm really excited today to have our viewers learn a little bit more about Ryder Trauma Center and the trauma services provided at Jackson Memorial Hospital. And we have three pretty amazing guests with us today. So I'd like to go ahead and just jump right in and introduce them. And then we'll learn a little bit more about what their roles are. But we have Dr. Gabriel Ruiz, who is the Medical Director, Trauma Resuscitation Unit, Ryder Trauma Center at Jackson Memorial Hospital, and a UHealth, University of Miami Health System trauma surgeon. Welcome, Dr. Ruiz.
Thank you very much.
We have Luis de Rosa, Center and a part of the trauma team. Welcome.
Thank you. Thank you.
And then Major Sonia Vargo, who is Army Trauma Training Instructor, Ryder Trauma Center at Jackson Memorial Hospital.
Thank you for having me.
No, of course, absolutely. And the three of you, thank you so much for taking time out of what I know is a really, really busy day to have this conversation with us. And, you know, before we get started, I want to kind of make a little opening statement. I'm born and raised in Miami, right? And every evening, there's not one evening that you turn on the evening news and that you see Ryder Trauma Center mentioned, and not always for the best things, right? Because of all the accidents or incidents happening in our community. But I'm happy to say that many, many people have a positive story about their experience at Ryder Trauma Center or have family members that have been there. So what you all do for this community is pretty amazing. So we're all extremely grateful. And I'm eager to learn a little bit more and secretly find out how community members can help support what you all are doing. So why don't we start with you, Dr. Ruiz? Tell me a little bit about what your role and what does a typical day look like for you?
Yeah, thank you. I'm one of the trauma surgeons in the at the trauma center, and basically what we do is provide care for the patients that come to us from the street that have been involved in traumatic accidents or violence, and we take care of them from the time that they come all the way to the time that they are ready to go home when they have healed. So it's a very, very important part of the mission to take care of them, and I've been part of the Ryder Trauma Center for almost a decade.
And what is some of the training specifically that you need to be a trauma surgeon that would be different than, let's say, I don't want to say a regular surgeon, because I think being a surgeon is pretty fantastic, but someone that's not in trauma, what specialized kind of training would you have to have?
Well, it requires a lifelong commitment to continue training and continue to getting new skills and advancing the science of trauma care. But additional to the normal residency that physicians do in surgery, which is about 5 years, we do two different specialties. We learn the skills that you require in trauma surgery, and we also learn how to take care of patients that are in the critical care in the ICU, the very, very sick patients. So that requires another couple of years of learning. So it's a long time of training.
Pretty long path. Well, we're glad you're here. Major Vargo, tell us a little bit about your role and what you do at Jackson with trauma.
Well, thank you again for having me here. I love representing the Army Trauma Training Department and the course that we have the partnership with Ryder. So what I do specifically is I am a clinical instructor. So we have 11 teams a year, active duty and reserve forward surgical teams. So we train them in a week of didactic, and then they do clinical shifts here at Ryder with the Ryder staff. We are elbows to elbows, taking care of patients together. And we do this before they go on a deployment. We validate basically that they are ready to go, and where's the best place to find penetrating trauma to replicate war type wounds. And Miami is the place for that. That's probably not something people love to brag about the city. However, the expertise that we have here and the evidence-based research that we have used in conjunction with our trauma training downrange is tenfold. It all comes together in the end. So that's what I do as an instructor here.
Is that unique to our trauma center, or do many other trauma centers around the country provide that same level of service to the Army?
That is an excellent question. One thing that makes Ryder unique is we've had this partnership for over 20 years. We have several other trauma centers around the U.S. that have tried to replicate what we have done here. Currently, we have a couple of things in the works, but they are still in their infancy as they are trying to build that partnership right now. So they're going through a couple of growing pains, but as I said, we've been here over 20 years. And I'm sure these two have seen multiple teams, multiple directors. Some of these rotators have come back multiple times and they remember them with the training. So the short answer is no, there is nothing like it. Miami has taken on this big responsibility and this big partnership. And I don't think they fully understand how great of a partnership this is for our soldiers, not only downrange, but also here.
It's pretty fantastic to hear that and to learn that. And Louis, tell me a little bit about the work that you do.
Well, I'm Louis DeRosa, like Flavia said, and I am the injury prevention coordinator. I do clinical outreach as well. Lots of education internally for medical providers, nurses, physicians, and also in the public as well, for the public non-medical folks. And I'm teaching injury prevention, preventing car accidents, driving safely, risky behavior, things like that. Stop the Bleed is another initiative we're working on, where we're teaching the public actually how to control massive hemorrhage and life-threatening hemorrhage, and also burn prevention as well. We do a lot of burn prevention. And one thing I think that's very interesting about my role here is that in the trauma center, I think this place is full of experts in trauma care. But at the end of the day, I think we all really rather not treat these patients. We rather, it's our ultimate goal is really to prevent injury and prevent people from being involved in risky behavior and being injured, and us having to treat them, right? Because the last thing we want to do is, be standing over a stretcher when you come in with fire rescue, or when you walk in after an accident. So it's a unique job description, so to speak, where I'm rubbing elbows, right, with experts in trauma care. And then all of a sudden I'm going to a public school and we're teaching the teachers how to prevent massive hemorrhage, teach the kids how to not get burned in the kitchen, right? Teaching parents. And so it's like the spectrum is very wide, right? It's like I'm teaching a lot of different people, but it's so exciting. And really, I stand on the shoulders of giants, right? I go out there and I'm representing this place, and it's my experience here and my relationships that I've developed with the military, my military partners and colleagues and friends and family, really, because you get very tight with them. And also, my colleagues here at Jackson. It's amazing to represent this place when I go out into the community. It's really fun.
So we're grateful. And some of you may follow Louis already on social media. He has a good following as the trauma guy. So if you don't already follow him, you probably should start. You'd learn a lot. I know we certainly do. Learn some lessons from looking at the neat things that he talks about. So I'm really excited to have this conversation with the three of you today. But this month, as you all know, Ryder Trauma Center is celebrating its 30th anniversary, opening just a few weeks before Hurricane Andrew in 1992. And I date myself by saying that I can remember Hurricane Andrew, right, pretty vividly. Since then, Ryder Trauma has been a landmark in Miami-Dade County. Talk a little bit about the significance of this trauma center, and not just for people locally, but from other parts of South Florida and beyond. What does Ryder Trauma Center mean to this community? And I'll let you, Dr. Ruiz, kind of start that.
Yeah, I think the people in Miami-Dade and in South Florida don't really know how valuable the resource of the Ryder Trauma Center is for the community, local here in our county, for the state, but also for the country. As you said, it was founded 30 years ago, almost 30 years ago, not only before the hurricane, but also at the peak of the violence in Miami during that time, where most hospitals that were providing trauma services decided to shut down. And it was Ryder who was left standing alone to take care of the patients around that time, which was a time of great need. Since then, we've built such an incredible experience, infrastructure, and we had so many people that are such a big experts in the care of patients in trauma, that I think that's the biggest impact in the society that we have today, is to have this equipment, this team of professionals, and the experience that we have built. We also have transmitted this experience to our trainees. We have incredible training programs that go beyond our local community. They also go in the entire world. Actually, we train people from 5 continents here.
It's pretty amazing. What would the two of you say makes Ryder stand out in this community?
I mean, exactly just kind of what Dr. Ruiz just said. One of the things I think people don't realize too is when these patients come in, Army team does not only take care of, veterans or whoever is left over. We take care of everybody, whether you're homeless, right? Whether you're somebody who's 100 years old, we do from the womb to the tomb, right? It's kind of the joke, but like we take care of everybody that comes through the doors. Yesterday or last night was a prime example. We had a very important person come through, and then we had somebody that was maybe not even known of, and they received the same excellent care. The Army team, everybody chipped in. So I think that's, again, what makes Ryder unique, is that we have that partnership where the Army team is here to take care of the citizens of Miami, regardless of where they are or who they're from or where they're from.
It's really a special place. I'm in a unique position where because I'm outreach and, I'm training out there in the public, and I also go to other facilities as well, other hospitals that are not associated with Jackson. So they're outside facilities, to do burn education, trauma updates, refreshers, continuing education, also in conferences and other places. And everywhere I go, when I tell people I'm from Jackson, from the Ryder Trauma Center, they look at me differently. It's a very odd feeling, but it's something I'm very proud of. This is a very unique program. And a lot of people don't know that it's right here in our backyard, at least the residents of Miami-Dade County. A lot of people don't know that it's right here in the backyard, this special place that really is a pioneer trauma center. And it's unique because of the standalone trauma center. I know we probably will get into that later,
Sure.
But it's a standalone, it's a freestanding building. There's only probably 2 or 3 in the country that are like that, which makes it even more special. So everybody here is truly experts. They breathe, sleep, think trauma 24/7. So again, really special place. I know that special is probably going to be a word that we're going to be repeating over and over again, but it's a great place to be in.
Well, and I think, one of the things that's really important is you want to have a trauma center like Ryder in your community, but to your point, you also never want to have to come in it, right? You never want to have to be a patient. So oftentimes the message that you're saying is people don't really know what they have. And, and in one way you want to keep it that way, right? Because it means that there's less people getting injured and coming in, but knowing that we have this in our community is just an incredible thing. Not only for people here locally, but I know that people get, flown here all the time from different parts of the country and the Caribbean and so forth that require the assistance. So for that, we're really grateful. Explain the difference to someone, and you all can tell me who can take this question better. What's the difference between an emergency department and a trauma center?
I think I can take that one. In an emergency room, there's emergency medicine specialists, the nursing staff and support staff, and as well as physicians that are trained to take care of the wide variety of emergencies that someone can go through, from an appendicitis to someone who had a traumatic event. The difference between an emergency room and a trauma center is, just as Louis said, we do this all the time. This is the only thing what we do. And for the public in general, you want your doctors, your nurses, your staff to be doing the same thing all over again every single day. And the reason is because the more we do it, the better we get at it. So when you say the trauma center and standalone trauma center is different from emergency room, is because we do this all the time. So we have better training, we have better equipment, we have a whole tradition of working with trauma care. And that's what makes us better, special, and what makes us able to provide better care. Now, for the residents of the county and the people that receive care, we do connect with the emergency rooms across the county, even across the nation, and even across the Caribbean. And we get patients that go beyond their capacity. So if you happen to have a traumatic event, car crash or something like that, and you're admitted to an emergency room, the emergency room has a network of transfer centers that will get the patients to us so we can provide that special care.
Well, I think that's really important for people to know. Absolutely. And I think we talked about some of the points of pride of Ryder Trauma Center, the Army program, the staff, everyone that's here and the specialized training that they have. But Louis, tell me a little bit about, you've been a trauma nurse for many years. So tell me a little bit about what it was like when you and your team get a call from fire rescue and you bring someone in. What does that look like?
Yeah, I mean, it's a very unique experience. I definitely, my first day here, I was really, I want to say overwhelmed. I was very overwhelmed with just the response, but everybody was working together. So like Dr. Ruiz and, Major Vargo said, this is a standalone trauma center. So we're really here on standby, right? Like the trauma team. And when the call, we do receive that call from EMS, fire rescue, air rescue. Sometimes we get a lot of patients from helicopter as well. And it's kind of like this hit the ground running, right? All the wheels start turning, pagers, we start paging teams, and people literally are in the trauma bay waiting for a patient before they arrive, like the entire team. When I say, so the trauma team really consists of trauma surgeons, trauma nurses for sure, respiratory therapists, x-ray techs, social workers. It's a whole team of experts that are really dedicated to the care of trauma patients. And preparation is key, right? So training, we all have to do a lot of training, a lot of simulation, a lot of sometimes that could be also very time consuming, but the whole name of the game is preparation and being ready for the residents of Miami-Dade County if they are injured. And I think that's where me personally, I take a lot of pride in that. I'm really into logistics and making sure our team's ready to go. And so when the patients arrive, we have, depending on the report that we get from EMS, we have everything ready to do our assessment. And like Dr. Ruiz said, we do the same thing over and over and over again with every single patient. It doesn't matter, your financial status. It doesn't matter your demographics. It doesn't matter. We do the same thing. We make sure we check off each box. And that's why our success rates and our outcomes are some of the highest in the country. And we truly have, I know Major Vargo said, Miami-Dade County is known for penetrating injury, and that's why the Army chose Jackson Memorial Hospital to train. And I know Dr. Ruiz knows this, our acuity level is, I think, one of the highest in the country, if not the highest. And so you're dealing with a high acuity level, right? Repetition. And we do the same thing over and over again. It's an adrenaline rush, just like the movies, for sure. Sometimes it could be overwhelming. But I think we do it so much that it just becomes, it's so routine for us. And we're just like a machine, a well-oiled machine. It's really special.
Patient volume, like on a month or on a yearly basis, how many trauma cases do we get?
We get about 4,500 admissions a year. And those are patients that get admitted that have accidents or are victims of violence, burns, that are actually admitted to the hospital. There's many of them that we see and we can discharge home. So you can probably make a good calculation of the amount of patients that we see every day. And again, we work 24/7. The doors are always open and we're always ready to take care of the patient. So it's a high volume center with patients that are really sick. And that's what makes the training so extensive and the experience so great.
I think I did see a data point not too long ago that we see an average, if you average it out, I think it's about 15 patients a day, some with higher or lower acuity. So, I mean, that's a ton of patients when you think about it for that 24-hour period. That's like every other hour, if not every 30 minutes, right? That you're expecting a trauma patient to come in a 24-hour period. Right.
Especially because every single patient, as Luis said, requires the entire team activation. So every time a patient comes in through the doors, they're going to see the entire team, from the nursing staff, social work, the trauma surgeon, that are going to be there in place waiting for that specific patient before the patient actually crosses the door. So if you repeated that 15 times a day, it's a non-stop type of work.
So I've heard this term used before, like, trauma level 1 or level 2. What does that mean? And what trauma level is Ryder?
So Ryder Trauma is a level 1 trauma center. The state of Florida only has 2 levels. So it's level 1 and level 2. It's a good question. That's actually a common question we get in the public. What's a level 1? What's the difference? Level 1 trauma center means you have all the services in-house 24/7. Nobody's at home with a pager waiting to get paged. And these are all your specialties too. This is neurosurgery, orthopedics, and the list goes on. Trauma surgeons are also here in-house. Your trauma nurses, you have to have a set amount of trauma nurses. And then there's also research that's involved. So you have to be able to basically provide it's a certain amount and a very high amount of research every year with an active research program. So that's kind of what differentiates a level 1 versus a level 2. I believe also pediatric. You have to be a pediatric trauma center as well, which we are a pediatric trauma center. A lot of people don't know that as well. But all the pediatric trauma alerts that below a certain age do come here to Ryder Trauma Center in the trauma resus area first to be evaluated before getting admitted. Level 2 trauma center is pretty much take away the amount of research, and as far as the services, they don't have to be in-house, but for sure you have to have a trauma surgeon on standby with the trauma nurses and everybody else. So we do have a level 2 trauma center, which is in the south end of the county at Jackson South, which we opened up in 2016 or 17. And I must say, I was there the first day it opened up, and I took care of the very first trauma patient. So proud of that one. I'm proud of that one.
That's fantastic. And I know that some of our trauma team does work in the community, right? So during the collapse of the Surfside building that happened, didn't we have some of our team members present and helping with the search and rescue?
Yes, that's right. Not only we were ready to respond for the eventual influx of patients coming from a disaster of the magnitude of the collapse of the buildings, but two of my colleagues, trauma surgeons and emergency medicine specialists, actually were on site during an entire week, participating in the rescue and the finding of the victims, along with the staff that were there from not only from the rescue, but from the emergency responses of the federal emergency response, and including some actually international teams. So we did have a presence from our staff on site, and we were ready here to take care of any patients as well.
I know that we also had our team was on hand for the Formula One race, right? A little bit of a happier note of an activity to be affiliated with. Tell me a little bit about the preparation for that, and what does that mean? What would our team do there?
That actually makes me very proud. Jackson and the Ryder Trauma Center and the Jackson Health System actually mobilized an incredible response into the event, something that is not replicated by any of the other events that are happening across the world, of the 20-some races that happen actually across the world. They actually brought the entire trauma center into the racetrack, something that the drivers or the part of the teams never had in any other place around the world. And we were able to actually set up an incredible trauma center. Luis, you were there. You probably can chip in and just share a little bit more about that.
I mean, it was an interesting experience. It was so fun. It was
Sounds impressive.
It was very impressive. And like Dr. Ruiz said, I mean, we literally had like 5 or 6 trauma surgeons that were on site, right, in the medical center, in the actual race, not the race cars, but the medical vehicles that they had all over the track. We had trauma nurses. We had our team in there just in case anything happened. And the preparation for that was a lot of work. It was a lot of work as far as the physical work with, really replicating what we do here and setting that up 20 or 30 feet from the track. I mean, we did have some good seats though. We had some great seats. Thankfully, like nobody was involved in a very severe or tragic accident. There was no large high impact accidents, or because that could be really bad, but I must say that in motorsport medicine, those vehicles, they when they crash, the drivers are pretty safe. We did have some crashes, but they were relatively safe, and we were all there. We responded. It was fun. It was very fun. I'm excited for next year. And it's definitely a cool experience. It's going on my my resume, my cool resume, right? Not my professional one.
So
and my professional one too.
So you guys basically set up a forward surgical team, very much like the Army.
That's
yes.
I had to chip that in. I had to
yes.
chip that in.
That's actually a great example, which is what the Army tradition actually help us do. Having the Army and knowing the resources that the Army has to take out in the field, downrange, how they call it. It helps us because we have part of the faculty actually are involved in the Army, are part of the Army, and that helps us know what we need there for the drivers and for the teams. And we set the bar really high up for the rest of the countries, but I think we're going to be able to do it.
So, just in your defense, the military wasn't able to participate with us just because they actually had a team that was here training. So it would have been fun to have you guys. But I must say this, that there were a few medical directors from around the world from other Formula One races around the world, and they were there, and they said that we did set the bar very high. I'm not sure if they're going to replicate it, but
Jackson, proud moment for sure. For sure. Now, all of these things that you all are talking about, for the trauma team, they're physically and mentally challenging, right? Dealing with these cases day in and day out. How do you decompress? How do you recommend to your staff that they decompress in order to continue to do this type of work day in and day out?
Well, it's part of the training. We have a long tradition of training surgeons here for the next step, which is becoming trauma surgeons and surgical critical care specialists. And part of the training involves being able to compartmentalize the type of situations that we're involved with, because we cannot afford to not be at 100%. We will always have one more patient that comes next. We will have one more trauma that comes next. And our patients deserve to have a group of doctors, nurses, and staff that are 100% all the time. We have mechanisms to decompress amongst the workplace, but also we look out to their families, to live a normal life. And I think, Major, you guys have worked a lot too in terms of being able to decompress the stress and decompress all the trauma that we actually suffer by taking care of those of the patients.
Yeah, I mean, that's such a tough question because I don't know that there is a right answer, to that. Everybody deals with trauma in a different way. And what makes, again, the military team a little bit unique is some of these individuals that come through here. We have medics and LPNs who are the specialty, like within the Army, like forward surgical teams. They're 18, 19 years old, and this is the first time they've ever seen something so traumatic. And that's one of the things that we make sure that we take care of each other because this might be the first time that they've ever seen this. And we want them to be prepared mentally and physically when they go downrange, when they go on this deployment, because you don't know what type of traumas, you potentially could see. And if that individual cannot figure out a good way to heal, whether that's internally, externally, with friends, family, and their team, then they're out of the fight. And we're such a small team already, like when we go on a deployment, that it's very crucial. But again, like last night's shift was a very tough one. This rotation has had a lot of traumatic, I think, trauma patients come in the last couple of shifts. And so we had to do a lot of debriefings with each other, making sure that they are going out, having a drink and talking to them and not being embarrassed about it. We have a team that has a lot of experience. And then we have some that are very young. And so we have to make sure that they feel that they can open up. And that goes the same for me. One of the great things about our partnership is that even with the trauma nurses and the docs, like we go out and have drinks and we go to dinner. And I don't think we've ever done that where trauma has not come up at least once. We talk about the job and in particular cases. And it is a good feeling to know like you're not the only one that feels a certain way. And so I think that support amongst your community at work, but also your friends and family from at home helps to decompress. And I also enjoy a good spa day as well. I'll throw that in there.
Tell me a little bit about, for each of you, what have some of your successes been here at Ryder? What would you say has been a really great day, right, in the time that you've been here? And I'll let each of you answer that question. I'll start with you, Major Vargo.
I feel like I have so many. I will say when I first started as a brand new trauma nurse, my background is actually ICU, intensive care. And I came here, I was like, I don't know if I'll be able to, hang with these trauma nurses. Like they're awesome. They're very well trained, very calm. So I think making it off orientation was always that's a huge win. That my civilian counterpart said that I am good enough to hang with the big kids. I think that was a really good one. That I've been entrusted amongst my team for civilian and military to train some of these individuals. But I think one of the best, most rewarding is when we do save that patient, the ones that were like, ooh, like there's no way that they're going to make it. And we've implemented things that the Army has adopted, i.e. transfusing whole blood is an example. Not all the facilities around the US do this. And this is something unique again to Ryder that the Army has also adopted. So to be able to take that learning lesson, that evidence-based research, right? And give it to the Army team, and then they can physically see it working and save a patient's life has been fantastic. So I don't know that I have a specific one, but I think, again, just having the trauma team, trust me to train, but also work with them and to take care of the citizens of Miami is probably always going to be at the top for me.
Sure. That's incredible. And for you?
Yeah, so it is a tough question. There's so many things that come to mind. I've been in Jackson in the trauma center since 2007. So it's like I've come across so many individuals, patients, families, so many special moments that really I'm proud of. I must say though, I think a very unique feeling. It's extremely unique to just our specialty is as far as goosebumps and as far as just like, really getting to that point where the tears going to come out is when we meet people that survive, right? And you meet them like 3 months later, a year later, and they're walking and they're in regular clothes and they're healed for some, to a certain extent, and they're thanking you, and you're just connecting with them, and you just, all you're thinking about is just that moment that you met them, if you remember them, because sometimes I don't remember some of these people that we meet, but the ones that stand out, and they come back and they meet you, and you develop relationships with them, and you ask them how they're doing, you meet their family. It's such an amazing feeling. It's truly the fruits of our labor. I mean, because especially in this kind of very acute setting where we meet people, sometimes we meet them for 20 minutes and then they're unconscious, we intubate them, the surgeons take them to the operating room, they do that amazing work. It's so amazing. And we don't see them, and then 3 months later they come back. It's really special. And I happen to be one of the coordinators of we do a Trauma Survivor Day, which is in it's in May. It's one specific day. We invite survivors to come, right? Like survivors within that year or within a certain time period, and they get to tell their story, and they get to meet the actual staff members that took care of them. So we bring those people out, and sometimes it's a surprise for them. They don't know, but they remember. Oh my God, I remember you. You were that nurse. You were that surgeon that stitched me up, gave me that IV. Held my hand, talked to my family. And it's for sure the family. They know the staff because you become very close to these families.
It has to be so meaningful for them.
Oh my
right?
God, it's so meaningful. It's so meaningful to see them just actually being able to live life and just continue on, as opposed to the complete opposite, which is, when we have to give them bad news, right? So it's terrible. And in the future, I would love to really expand that Trauma Survivor Day to not just one day, maybe, or a press conference, but maybe just like a gala where we could bring these folks in and really make them feel special and things like that. So it's something that we're thinking of doing in the future, obviously post-COVID. So, but we're excited about that.
And you, doctor?
There's so many stories of success that I will fill up an entire program just to name a few.
That's a good thing that there's so many of them, right?
But that's what keeps us afloat, is the stories of the patients coming back and seeing them again and knowing that they made it and they recover and they're healing with their families. Success stories in the academic part of the trauma center are also incredible. We are at the leading edge of research. We are the selected trauma center for our law enforcement officials, the people that are very important in the county and in the nation, politicians. We are the place where they come if there's any emergencies. We are also the trauma center where we train surgeons that go all around the world. Just to give you a brief example, every single trauma surgeon that is working in Israel has been trained here, and every single trauma director of a trauma center in Israel has trained with us, and it's part of a tradition now that they come to us for training. And beyond that, going to work in a place where you don't have to worry about whether the patient's financial status is good, insurances, and going home knowing that you gave that person the opportunity to go back to their family, that's the ultimate story of success for us.
Yes, that is so meaningful. Thank you so much, all three of you, for sharing that. Now, I want to ask this question. So clearly, I'm with the foundation, right? And we're responsible for philanthropic dollars and working with the community. So tell me about your little program that you have going on here, and this is one way in which we feel that community members can give back, and we'll talk about different needs for Ryder, but I always like a prop, so let's start with that and talk a little bit about this program that you mentioned to me.
Thank you. First of all, thank you for all the work you guys do in the foundation and really kind of helping the community, and whenever you guys see a need, you guys are there. Even during COVID, I remember where you guys really orchestrated, whether it was food, whether it was we needed masks, it was really amazing. I was part of the COVID command center. I got repurposed, so to speak, and to help with the logistics and things like that here at Jackson. So it was very interesting. But, really, this is kind of a current initiative that we're doing, and I'm spending a lot more time than I should, orchestrating and coordinating it. But I mean, it's really special and it's dear to my heart because I think, we're trauma experts, and so when patients bleed when patients are injured at the scene and they're bleeding and hemorrhaging, they have worse outcomes. So a real national campaign is called the Stop the Bleed campaign. This is not a Jackson Memorial initiative. It's a national campaign, and it's really to teach the public and those that don't have medical experience or medical education how to control that bleed after injury, because the idea is to keep the blood right in the body. This is life-threatening bleeding, and not just gunshot wounds. It could be shark bite, it could be propeller injury. People are on the boat, right? We could just
Yeah.
creative here. And so, one of the things I was thinking of was we have a lot of security guards throughout the Jackson Health system. We have, they're part of public safety, right? So they're there in the perimeter. They're manning the, the portals of entry, so to speak, the lobbies. And so sometimes they come in contact with these patients who get injured first. They're the first ones to make contact with these patients. And then what they do is they actually, initiate an emergency response internally, and
Sure.
the emergency teams or the trauma teams actually go out to meet these patients wherever they're at, whether they're outside of the hospital, in the trauma center, within, Jackson, jurisdiction. And so we wanted to train these public safety officials and also the front lobby greeters how to control hemorrhage. And so right now we've trained approximately 160. There's 230 in total within the system. And so we've trained 160 in the past week. So it's been a lot. And it's with the help of my colleagues throughout the trauma center and with the military as well. So we trained them. And so in Jackson, Maine, there was quite a few. So it took a long day. So we gave them the training, and we also have kits, right, that we want to actually install at every single portal of entry, like the lobby, and also public spaces that are high risk. So like the cafeteria, anywhere where there's high traffic, just in case somebody's injured. Because not every patient actually gets, calls 911 and fire rescue shows up, or EMS. Some people drive themselves to the hospital. So the first person they meet are our public safety colleagues. So we want to train them, right? And we want to also provide them with the equipment that they can use to effectively control the hemorrhage until the emergency teams come and pick up the patient. Because our main goal is to improve outcomes, improve survivability, and that'll help. So in reality, they actually become an extension of the trauma team. Right. So that's for our public safety officials, and in the community, we do this as well. So one of the things that would really help is actually we need more kits, actually. So we were able to get kits here at Jackson, Maine, but we just did a training in Jackson South as well. So we need some kits down there to make sure they're covered, and also Jackson North and Jackson West. And this really would help, just in case, God forbid, we don't ever want to use these supplies, but now we know they are trained, they know how to use it. And it's just simple measures as applying pressure, and if needed, applying a tourniquet, which we give them the training as well.
Yeah. So this is an absolute way that some of our donors could help support, or in some of the funds raised that would go to Ryder would help to purchase some of these kits. Doctor, in your opinion, what's next for Ryder Trauma Center, right? What's a vision and a dream that would make Ryder Trauma Center more amazing than it already is? If we can think of that, what would that look like?
I think what I see in the future for the trauma center is to continue to expand their education, the outreach to the community, to continue with the Army Training Center and the partnership that we have, and in general, to be able to provide even more services to the community. And that's a point that actually touches a lot in the community support that we need, keeping this place open, ready 24/7 to take care of your family members, of your parents, of your children, is something that is really expensive. So we need the community to pitch in and help us keep this site functioning. The Jackson and Jackson Health System, Jackson Foundation have been great with us, helping us with that side of the work. So for the next 10 years, I see the teams to continue to expand in the services, to be able to provide even better care to our patients, and more education to the new generations of surgeons and physicians that are coming.
Yeah, and I think you said this earlier pretty eloquently when you said, at Jackson and at Ryder, we take care of everyone, right? We don't turn anyone away. And I think, Major, you also mentioned that you could have pretty important person, right, from a community perspective, and a homeless individual right next to each other, and they're getting the same level of care. And I think that's what makes this institution so special. And really the bedrock of this community is that Jackson and Ryder Trauma Center is here for everyone, right? And along with the academic partnership that we have with the University of Miami, really makes us a standout organization. Are there any things that we didn't cover, that we didn't talk about, that you would want to share with our audience?
Yeah, so many stories of success, and again, we need an entire program to just talk about them. But just to let the community know things that the community might not know here in Miami-Dade, the entire science of surgical critical care, which is one of my specialties, which is the care of the patients that are really sick. After you get injured, then we take care of you in the trauma center. You're going to require very special care, very advanced care. That entire science was invented and developed here in Miami. was developed with the University of Miami and the partnership with Jackson Memorial Hospital in these very same grounds in 1975. First in the nation. We have the biggest fellowship training program, the longest standing surgical critical care program. So it's just to let the community know that we have the tradition, that we've been doing this for a long time, and that they can rest at home knowing that if they need us, we're up to the challenge and we're ready to serve.
Well, that's fantastic, because that's something I didn't even know. So I'm glad to learn something new. Any final words from either of you that you want to share?
One thing I did want to kind of touch base on, it's a little bit more of like a humbling moment. So in 2017, before I actually deployed, I came through our Army program as a student, where I had different cadre. I got to work with this team in a student level, and it's a tried and true program. I deployed, I was a better leader, I was a better nurse, and I absolutely took care of my patients at a whole nother level. And I am convinced that the reason my team was so successful on our deployment was because of our experience here. And then a couple years, right, you fast forward, and then I get to be asked to come back here as an instructor, to then now give back to the teams and to give back to the community, but also work with my partners. And so that humbling moment of, I'm not just, an instructor, do what I say, don't do what I do kind of thing, that I've been through the program. I'm a firm believer, and I do believe that I am a better, trauma nurse, and again, and leader because of this program. And so my final words is ultimately a thank you to the Ryder Trauma, staff, because I don't think they quite realize what a great impact they have on these teams that come through here. So I hope to see, again, a continued relationship 10 years from now. And I would love to say, oh, back in my day when I was at Ryder. I'm hoping to get to say that someday.
Sure, that's a full circle moment for you.
Absolutely.
For certain. And you,
I do. I just want to point out, I do remember when Major Vargo was here in 2017, she was a student and she had her little fanny pack. It was actually a big fanny pack.
We call it the trauma Gucci bag.
It was the trauma Gucci bag, and it was filled with, it was everything you could think of. And we were all like, whoa, she's ready for war, so to speak. Anyways, but so it was a pleasure having you back then. And also it's an honor to work with you. And thank you for your service, by the way. And so, I mean, in regards to just adding a couple of quick points is, I do agree with Dr. Ruiz. I think really want to expand the education here. This place has so many experts. It's amazing. And, again, I'm in a position where I go out to different places, and when they talk to me, they're just like, they want to pick my brain and ask me questions. And I feel like I'm not even the most expert person here. There's so many other people that are great and amazing. So with that being said, I do want to expand our education internally and also externally for in the community, but also even create some kind of program here where we're actively training and doing simulation. And I mean, this is a bigger picture thing, but I think it's really special. And I think the knowledge that we have in this place with all the individuals that work here, we could share a lot of and really advance trauma care for others in our community. And I think expanding on that and would be very helpful. And I just want to add one more thing, that we also and this is a proud moment for me, we actually do burn prevention. So I know this is more for the burn center arm of because we are a burn center as well. So it's trauma, burns, we're everything, spinal cord, I mean, adult, pediatric. That's what I always tell people. We're like everything, every resource is here. But we do burn prevention in the community. Every year we do a children's fire safety festival, which is pretty amazing. You are invited for sure. And we do it in collaboration with all our EMS partners. So there's about 6 fire departments in Miami-Dade County, including the Air Force. And we do for 1 week, and we train young children. They come for 1 week, about 2,000 kids come like a field trip from school, and they come through every single day, and they do different little interactive education stations or interactive stations where we teach them how, burn prevention, basically how not to be injured. And this is in collaboration with all the fire departments. It's pretty amazing. So if you ever want to come through, we're going to teach you how to stay safe in the kitchen. Okay.
I try to stay out of the kitchen as often as I can, but you can still teach me how to be safe in there. I really want to thank all 3 of you. I mean, I'm honored to be able to have this conversation and feel like I learned a little bit more about the great services that we have here. And for all of our viewers, I hope it was insightful for you. I hope you learned a little bit more about the Ryder Trauma Center and the great teams that are here. And like we said, ready and waiting, hoping that you never have to walk through the doors. But if you do, having full confidence that they're here. And if anyone is interested in supporting the Ryder Trauma Center, you could do that by visiting our website at jacksonhealthfoundation.org, or you can call our office at 305-585-GIVE. Thank you so much and have a great afternoon.